Welcome to the Supported Living Property Podcast with your host, me, Lisa Brown, the place to learn about supported living property investing. Hi, Andy. It's great to have you here today. Thank you for joining me. How are you?
I'm good, thank you, and thanks for the invitation.
Oh, it's great. I'm really looking forward to this. We've got lots to talk about today. For people who don't know you, do you want to introduce yourself and tell people a little bit about you?
Okay, so my name's Andy Robinson, and I'm from Somerset, in the South Somerset, in the West Country, in the UK. And I'm the CEO for You First Support Services. We are a social enterprise formed as a community interest company that provides community-based support for adults with learning disabilities, autistic people, and people with a mental health illness. And this month, actually, we're celebrating our 10th year. It's our 10th anniversary this month.
Wow, that's brilliant. And
Yeah.
because this is an organization that you founded, isn't it, Andy? So how did you come about? How did you end up doing this?
Okay. So I've worked in social care for like 30 years, if not more. I mean, Botox is an amazing thing, isn't it? Yeah, probably getting close to 35 years, I should think. Um, and for many years, probably like 25 years, I worked for Somerset County Council, as it was then, recently become Somerset Council. Uh, and I started there as a team leader where I managed a team of people supporting about 6 people who were living in a supported living property. And I also worked bringing people from residential care into supported living for the county council. And then became a service manager. Over a period of about 5 years, I progressed to a service manager where I was like responsible for 6 schemes. And one of the strengths I had, and one of the jobs I was often given, was working with people in residential care and supporting those services to transfer to supported living. That was a big part of my work, really. Um, and also within residential care to bring people up in their CQC inspections. I was often sent in as a bit of a troubleshooter to to look at why people had low CQC grades and to look at that and to improve that. Um, so quite a mixed portfolio, really. But I was with them for many years. And Somerset was quite unique. Somerset retained its in-house provision far longer than most other local authorities in the UK. But then the writing clearly became on the wall that the LD service within Somerset was going to spin out, and I had particular questions around some of the direction of that. And I used to sort of voice my opinions. And then one day I just thought, why am I just bleating about this? Why don't I actually just get off my backside and do something about it? And that's what I did. And that's when You First was formed in February 2014. And it was really important to me that we were formed as a social enterprise and that we were formed as a CIC. That was important because one of the big drivers for me is that the people that we support are in charge of every aspect of their support. Often social care can look like we're reaching out and looking after people, needy people, people who need to be sort of held or wrapped in cotton wool, these sort of things. And UFA sort of spins that completely around, really, and says, no, the people we support are equal people. They have and should have the same rights as you and I, should have the same equal opportunities. And in fact, they should be in charge of every aspect of their support. So being a social enterprise and having the asset lock that a CIC brings, very similar to a charity.
I'm just going to say that's for people who are listening who are going, a CIC, it's a community interest
company. Yeah. So we're formed as a community interest company, which is it's a limited company by guarantee, but we don't have shareholders. So we work with stakeholders, and it has an asset lock, very similar to a charity. So directors can't asset strip. So although I'm the founder, and I'm a director, I'm actually employed by the CIC, by the community interest company. So if I was to retire, which I legally can do in 7 years, I don't take anything with me. I can't. There's no dividends, nothing like that. And the CIC. So what that was important to me because the message I wanted to convey was that the people who we support are, in a real sense, the owners of the CIC. It's all about them. So if the CIC was to be wound up in any way, it would have to transfer to a CIC or charity with very similar aims. Yeah, hopefully that makes sense.
It does make sense. Yeah. And I think that's quite a unique way of setting something up, isn't it? And I think I can hear people listening, and I can kind of imagine with my old-fashioned nursing voice in my head going, yeah, but some of these people do need looking after. Some of these people
Yeah,
do need someone to help them with the decision making,
yeah.
So how does that actually work, Andy?
Okay, so we've got a unique approach to assessment. We don't use the word assessment as such, and I say it's unique. It's built very much on the National Health Service's life plan, individual service design, which was introduced particularly around the transferring care agenda. And it was called individual service design. And I looked at this, and the first thought I had, I guess coming at it from a social model or a medical model, was that people don't want a service, people want a life. So I looked at the framework, and there was loads of good stuff in there, and I tweaked it and played around with it, and it's evolved over the years, and we've called it design for life. So when we meet somebody for the very first time, we go and meet them, and we meet the people that are important to them over a number of visits, and we complete this design for life tool, which is about not discovering the needs the individual has, but who are they? Who is this person, and what do they actually want from life? What are their aspirations? What are their ambitions? What are the things that make them laugh? What are the things that they don't like? What does a good support worker look like, as far as they're concerned? And one of the unique aspects of it, I guess, is that we go right back to through their life story, and we work with the parents or carers, responsible adults, whoever's looking after or has been supporting this person, and map out their life story actually right from birth. So it's a heavy investment in time. It's resource heavy, but often during finding out this person's life story, I see parents and carers actually having light bulb moments. Oh yes, that happened, and that's why this person does this today. And it helps them join dots as well. So we have a whole holistic picture of who that individual is, which is very different to traditional assessment. In some of my very early days in social care, I can remember working for a large company in Somerset that supports older people. I joined as a care assistant, and my manager thought there was something about me quite early on. So a few months in, she used to send me out to do assessments of people who were moving into the home from convalescent hospitals. And I used to go out with this sheet, this pre-printed sheet that just had can't do, can do with support, can do. It was just those 3 columns, and a care plan was built on that.
I remember those kind of things. Yeah.
So it was absolutely task oriented. Now we can do that, and that saves a lot of time. It saves a lot of effort. It saves a lot of money. But if I was to produce a care plan that was purely task oriented and hand that to a support worker, that support worker, through no fault of their own, will just deliver task oriented support. There'd be no relationship. And for me, the foundation of social care is relationship. It's a professional relationship, but it's a relationship nonetheless. And there has to be mutual trust and mutual respect in there. So Design for Life helps that, because we actually get to know who that person is as a human being, as an equal person. So Design for Life is central to the way that we approach support.
That's amazing. And that is a very different approach, isn't it, to what's being used in a lot of other places still.
It is.
Still very task or very kind of like regimented in the approach that the assessment takes. And then obviously, I mean, it sounds amazing. It sounds like such a brilliant model that everyone should really be adopting. But I'm sure there are challenges in providing this kind of support, and challenges that you're encountering in delivering support. I know one of the reasons we connected was one of the big challenges that you're having at the moment.
Yeah. So we obviously connected over housing challenges. If I can just say one more thing about what Design for Life leads to, and this is indeed a challenge. We work what we call a micro team model. So Design for Life will capture everything about the individual, who they are, where they've been, their journey, and then what they're looking to for the future, and what they think will make a good support team. And then we use that as a recruitment tool. So we recruit specifically for that individual. And we call this micro team. So we devise a micro team around that person, a community of support, if you like, around that person. So the person supported knows who's supporting them, and they can build those really important relationships with those people. And one of the challenges that brings is rostering. It's very easy to. So we provide about 1,600 hours of support a week now. So that's made up of around about 45 people that we support. We've got about 90 staff that provide support. So writing a roster would be easy if we just threw human beings at gaps in the rota. But we can't do that. If we're serious about person-centered support, the individual being at the center, and increasingly if we're serious about self-directed support, so the person is in control of their whole support package, they can't be supported by strangers.
No.
Particularly, you can't have somebody who's say is on the autistic spectrum, who needs predictability, routine, knows what's coming next, all of these really important things. They can't just have a stranger turn up. So we build these discrete teams around people. So the person supported would only be supported by those 5 or 6 people. Now, those 5 or 6 people may work in a couple of other micro teams, particularly as people increasingly want full-time hours and things like this. But the person supported will only experience that small team, that discrete team of people around them. So that is a challenge. That is certainly a challenge in terms of roster writing.
I'm sure, because in real life, people need holidays and
exactly.
days off and get sick.
Exactly.
And,
exactly. Yeah. But it's a model that works. It's a model that's certain. Quite a lot of the people that we support have come to us where there's been service failure. So they come to us because their support package has collapsed. The micro team model provides that consistency and continuity that people need. But yes, it certainly does bring challenges for us. And if I go into the office of a morning, I can always see who's writing the rota that morning.
Because writing a rota anyway is stressful, isn't it? But without a challenge,
yeah. And then, of course, you mentioned how you and I met, and we met through a need for housing. That is a significant challenge, because I've taken you through like a whistle-stop tour of Design for Life, and so the support we provide is bespoke. So one of the constant challenges that we come up against is that people require bespoke housing. Years ago, when I was again working for the council, we used to talk about person-centered support and how you can't squeeze somebody into a model of support. Unfortunately, that does still happen, but that's an accepted phrase these days. You can't squeeze people into a model of support. Neither can you squeeze somebody into general housing. Really, that's my experience, particularly people on the autistic spectrum. People have got sensory sensitivity, and I think one of the big lessons we've had to learn, and commissioners need to learn, and it's an ongoing lesson, is that the housing environment, that your immediate environment, is as important as your support team for the person supported. Because anything can trigger. And we've been working with somebody now it's getting close to 3 years. We've only been working for 18 months of that 3 years, but there's been a 3-year story where somebody who's had service failure after service failure because the local authority hasn't got the housing issue correct. And that's involved, and there's been police involvement and all sorts, because the resultant behaviours are quite significant. And we've met with the person, gone through a really detailed Design for Life, and this chap is that there's a real clear criteria to his housing, but it is so unique, so bespoke. To actually get that to happen in real life is proving very, very difficult. Yeah.
And it's really hard, isn't it? Because I was in a meeting the other day, and this young man with learning disabilities said in the meeting, I was asked to move into a void, and I had to look at what a void was. And he said, I don't want
Right.
to live in a void. I want to live in a house. I want to live
Yes.
in a home.
Yes.
And
Absolutely. Absolutely.
entirely right, you know. And so we have this ongoing challenge, don't we, where we need to be creating the right homes for people, particularly when people, like you said, have those sensory sensitivities, when they've got you know, more complex requirements around their property. But you know, you are among a handful of other providers that I work with, you know, increasing numbers of people who are looking for these kind of properties, and we're really struggling to get the solutions that we need for some of these individuals.
Yeah, absolutely. And I met with this chap some time ago, and I asked him I said, so from your perspective, what would an ideal house be like? Where could you see yourself living safely? Understanding that people on the autism spectrum they're seeking a safe environment, somewhere where they feel safe from all these triggers. And he thought for a moment, and he said, I want to live in a castle with a moat around me. Which on one hand you smile and can laugh at, and we did laugh. I chuckled with him, but the logic in that, he totally understands his needs and where he's coming from, you know. And obviously he isn't going to live in a castle with a moat around him, but that's that's the kind of safety that he needs. And as you just said, he's not the only one. You know, there are many people in this situation. So I had a very interesting meeting yesterday with somebody I actually met through the Supported Living Network. We've been chatting quite a lot recently. I met with this chap's mother as well. How can we actually make this happen? And the last conversation was, okay, perhaps we could purchase land and like have new builds, but perhaps build more than one property a fair distance apart. Can we screen them? Can we make them soundproof? All these things that we were looking at. And Mum thought that might be a realistic compromise, but obviously we need to go back to the chap and have that conversation with him. So that's the idea that we're pursuing at the moment.
And I think it is about being really creative, isn't it? And ideas like that. It's like, actually, how can we create that castle with a moat feeling for him?
Yeah.
But in a relative, it's got to be in a cost-effective way that can actually realistically be delivered, you know.
Yeah. Which then comes on to the other challenge, isn't it? Because particularly, I'm in Somerset, and we know Somerset Council are facing significant financial crisis. So they're going to be frowning at, you know, rent tests that go through that are pushing the boundaries. And all these sort of things.
Though if you're working with an RP partner, you can get, you know, you should be able to get 100% of that back from central government. So it shouldn't come out of their direct budget in that way, but they still have to approve it, and they still have to go through a process. And not everyone seems to appreciate that it doesn't come out of their budget directly.
I know.
Yeah,
that's true. Yeah,
and that is a challenge, isn't it? It's reminding people that it's not necessarily like that. You know, and it's looking at the cost savings, because I can imagine there are some people listening to this going, well, that's just ridiculous. Why should that be, you know, why should this individual have that kind of property on their own? Why should they not just be in hospital? Why should they not just be, you know, whatever situation that, you know, they think might be more cost effective? But I think it's understanding the other costs involved in those situations actually do end up being a lot more expensive most of the time, don't they? The studies that have been done on supported living.
Incredibly expensive.
You know,
yeah, incredibly expensive. And we've worked with people now. We've got a whole series of success stories. There's one lady we work with. I think I probably told you this story before, but she came to us looking for support around, goodness me, almost about 5 years ago or so. And she'd been sectioned. She'd been in hospital, where she was given loads of unsavory labels, you know, difficult, challenging, aggressive, all these kind of labels that people get given. When she came to us, she was being supported 3-to-1 by a local provider. And she was, again, you know, labeled challenging. People have been hurt, damaged to support worker cars. And she came to us, and I went to see her. And it became very clear as we were going through the Design for Life process that all these behaviours were coming from a lack of control. You know, people were doing to her, and that had been her experience of social care and indeed health care. And now she lives in her own property. When we first started supporting her, she was in some supported living property. She's now in shared ownership. She has been to college and done carpentry courses and has come out with qualifications. She's into gardening, and she was selling veg to a local restaurant, because she's very savvy when it comes to making money. um, and she's totally in charge of her support. We now support her one-to-one, and did one-to-one pretty much from the offset. And she's now having gaps in the day where she's completely on her own. So we've got stories of where somebody could have been, well, and indeed she was in hospital, very expensive package of support, and now that person's being supported to be a meaningful part of a local community. And that's what we're about. We don't want to see people locked up in hospitals, and most of the people in them don't need to be in them. They can have meaningful roles in their local community, not just being present but contributing, giving something back to the local economy. And that's certainly what this person does.
That's amazing. And from a purely economical point of view, the cost saving involved in her support being dropped so much, significantly.
Yes.
As well as the impact on her quality of life and the life of everyone around her.
Absolutely.
It's huge.
Yeah. I often say
That's
to our
such an
team
amazing story, Andy.
Yeah, part of my job as CEO is to put you first out of business. That's the kind of ethos I have in my head. That my role is to. So we want to see these packages of support decreasing. I remember saying this once to somebody who provided a very different kind of social care, and they looked at me as if I had three heads. And I said, "But look, as with a business hat on, the local authority will then look at you first and be thinking, hang on a minute, let's give them some more work, because they're actually bringing the cost of care down. So it isn't a self-defeating exercise, actually.
No.
Many of the people that we support will always need a level of support. But actually some people don't. There's one chap we used to support. He lived with his mum in a bungalow. I can remember meeting him for the very first time. That father had very recently died. Her husband and father had very recently died. And it was clear that they lived a very controlled life, and the son had been told that he would never achieve anything, never become anything. So we started working with them both. The son was very resistant to support, but we began to establish good relationships with him. And then became clear he wanted to pass his driving test, and his support worker team, was sort of thrown into panic about this. And I said, well, it's not for me to say whether he can drive or not. That's for a driving instructor to say. So we engaged one. He'd had some off-road lessons, and then began to go through his driving lessons. He passed his theory first time. He then passed his driving test, got a vehicle. That led to a job. That led to a girlfriend. And now we don't support him anymore.
Amazing.
Yeah.
That's so good. And
that's in a nutshell what we're about.
And that's what I love about your approach to things, because it is so different, I think, from, and it challenges. That's why I wanted to get you onto the podcast to talk about this kind of stuff, because I think for care providers listening and property investors listening, it's a different approach, isn't it? And I think it's great to just think about different ways of doing things. The property side of it is obviously challenging to get hold of for people, but do you think the property side actually is as important as the support? Do you think they're equally important? Do you think one is more important than the other?
I think for some people, particularly autistic people with sensory sensitivity, housing is part of the support package. And indeed, it forms part of the Care Act. It's a Care Act requirement for local authorities to look at suitable housing for people. My experience is I'm not completely sure local authorities have got their heads around that, but it is an important part of the Care Act. And yes, many people that we support can live in general needs housing without any problem, and do so successfully. But for some people, the chap I've spoken about is another woman that we support who equally has sensory sensitivity, and we had to involve occupational therapists and all sorts of who are experts in sensory environment. And it will be the same for this guy. Getting that absolutely right, to make that package of support stable and consistent, and so that person has a forever home, can put roots down, like you and I. So yes, for many people, as important. In fact, it forms part of the package of support.
And seeing it as a joined up thing as part of the support.
Yeah, absolutely.
Yeah,
absolutely. And that's so the conversation yesterday with with Sam from the Supported Living Network, we've shared the Design for Life document, a hugely confidential document, with the person's permission, obviously, a mum's permission, because he needs to understand that, to get the building right, to get and for this chap to finally move into his own home. That sharing of information is crucial, because in a sense we're all part of the care team.
Yeah, and that makes me so excited, because that's my vision with setting up the network, was actually bringing people together to collaborate property. I mean, it's all over my website, the word collaborate, but that was why, so that actually we can take this approach where actually they can, a good property investor can get involved at this stage and really try and see if they can really shape and help. And so it's really exciting to hear that that's big, that is happening, and that you guys are building that relationship to try and solve this problem and create a home.
And for the property investor, obviously, this will be a long-term investment. This chap's going to live there he's only 30 or 32, I think. And he needs to start living his life. So it will be a long-term investment. So it's attractive on a number of angles.
Absolutely, it's a great way to hold property, isn't it? I know anyone who listens to me knows I bang on about it all the time, but I do really think if you get it set up right, it can be one of the best ways to hold property for the long term. But you have to understand the commitment you're entering into as well, don't you? It's it's part of a thing, and that's why it needs to be done right from the beginning, so you understand it all. It's brilliant. Thank you, Andy, for coming on and sharing your experiences and sharing your vision and the way that you operate. It's really good to hear that, and it would be great to do an update, and hopefully when we find out, we'll see where things go in the future with this, and that would be great.
Absolutely. Appreciate that. It's great.
Thank you, Andy.
Thank you.